to file, but in a letter to Government of Guam employees, TakeCare states it was compelled to do so as a consequence of what they allege are discriminatory and chaotic actions of DOA and the health insurance negotiating team.
Clearly, we're not happy with what's occurred.
TakeCare Chief Operating Officer Jeffrey Larson tells KUAM that the protest was filed because the procurement process was not followed and was handled by the government in a chaotic and unusual way.
Yeah, it definitely feels like there has been some deselection and particularly action against TakeCare inappropriately, especially since the procurement rules are pretty clear. And when you're invited to negotiate and then uninvited, that seems like something went wrong.
In its letter, TakeCare states that it was advised in writing that it was one of the top 3 bidders for the GovGuam health insurance contract. However, the following day was informed negotiations were instead canceled, and thereafter advised that its proposal had been re-ranked and would not be allowed to negotiate any health insurance plan.
So not having the island's second largest insurance at the negotiating table seems like it's unfair, and certainly we're qualified to be there.
DOA Director and Negotiating Team Chairperson Benita Menglonia did not want to comment on the matter, nor could offer details as to how far in negotiations the team was at, but instead would forward a request to its legal counsel for proper disposition. Larson says the negotiations should really be about transparency and getting the best possible deal in the interest of GovGuam employees.
So the negotiation should be clearly stated in what the RFP is. The procurement rules should be followed, which in this case was not the case, and ultimately it should be fair.
Committee on Health Chair Senator Dennis Rodriguez Jr., meanwhile, says he is aware of the protest but could not offer any further comment. Rodriguez, an ex officio member of the negotiating team, did, however, say he hopes the issue can be resolved soon, especially as a contract must be in place by October 1st.
It'll be the best interests of our people, of course, if it's resolved soon. These things can, as you know, protests, and if it heads into litigation, can last very long. And that won't be in the best interests of our people.
When asked whether information provided in the protest letter was meant to be confidential, Larson says the RFP process should be confidential, but states the information made public in the letter was disclosed to the company by DOA. TakeCare, meanwhile, has requested that the procurement be stayed and that no award of the GovGuam Group health insurance contract be made until there's a resolution. We should note that TakeCare is no stranger to being in the headlines. As we reported, Senator Rodriguez, along with Congresswoman Madeline Berdalio, had asked for investigation into TakeCare's actions in paying its shareholders $15 million, despite $11 million in unpaid claims and not paying a single penny in rebates under the Affordable Care Act. Meanwhile, it was earlier this year the GMH board voted to terminate a direct payer agreement with the insurance company. The GMH board's decision was based on the company's denial of coverage and its rate of paying GMH, which reportedly was at 50 cents on every dollar. After weeks of negotiations between GMH and TakeCare, the decision was rescinded. Reporting for Guam's News Network, I'm Ken Quintaniza.